And I'm not the only member of the Daybreak team practicing some social distancing this morning. Our health and wellness reporter Sonia Azadi is as well. And Sonia, we know that folks of all ages have concerns about coronavirus, but we're learning some new information about how a lot of pregnant women have some special concerns as well.
Yeah, Mark, and that's understandable, and as they should, right? Every day we learn more and more about COVID-19 and its impact on some of these vulnerable populations, or as we call them, immunocompromised, and pregnant women do fall under that category. It's a scary time to be an expectant mom, I can imagine, but there is some sliver, right, of cautious optimism when it comes to pregnancy and COVID-19. I want to have you consider this, right? Dr. Alex Peel, an obstetrician, gynecologist, and researcher at the University of Michigan, says early data from China suggests there are no known cases of infants being born with the virus. And that's reassuring because it means there hasn't been a direct spread from an infected mother to her baby. That's what's called vertical transmission. But Dr. Peel also says there is still reason to be cautious, especially after birth.
So there are some newborns that have tested positive, and we think that this is from the same way that adults get the virus, through air from cough and sneezing, personal contact, and contact with surfaces that have the virus. And so it's really important that if moms are positive, that they're wearing masks and being very careful when interacting with their babies.
Now, since infants are not immune to the disease, parents need to take precaution. That includes social distancing, really limiting who's around your baby, washing your hands frequently, also sterilizing toys and disinfecting household items. Dr. Peel also says that there are changes when it comes to regular hospital checkups for expectant mothers, also for delivery room rules. Okay, so there might be some changes there at hospitals across the country. So you can hear more from Dr. Peel coming up on Good Morning America.